So we have two copies of each of our genes. A carrier is someone who has one copy of the gene with a genetic change. We call that a variant. And then one copy of that same gene that is working just as it should. And carriers are usually healthy because they have one copy of the gene that's able to function and provide the instructions for their bodies.
You said genetic change. So you're talking about something that could potentially cause disease, right? If a carrier is somebody who has one gene that has this genetic change, then what if somebody has two copies?
Hi, superhumans. I'm Dr. Mavis Garcia.
And I'm Dr. Wise.
We're two of the physician leaders at Markham Fertility Centre, otherwise known as Our Baby, MFC.
As fertility specialists, we've witnessed firsthand the challenges, triumphs, and the myriad of emotions that come with trying to conceive. Whether you're just starting to think about having a baby, actively trying, or facing challenges along the way, My Fertility Podcast will be your go-to resource for honest conversations and a supportive community.
So grab a cup of coffee or tea and settle in, and let's demystify the world of fertility together. On this episode, we welcome Diane Myles Reid. Diane is the genetics lead at Markham Fertility Centre and also the president of the Canadian Association of Genetic Counsellors. She's joining us today for the first time to talk about the topic of carrier screening. She's going to join us on multiple episodes related to genetics, such as pre-implantation genetic testing for aneuploidies, pre-implantation genetic testing for monogenic gene disorders, prenatal testing, and with that, we leave you with carrier screening today. Thank you, Diane, for being here, and welcome to My Fertility Podcast.
Thank you, Dr. Weiss and Dr. Garcia, for having me today. I'm so excited to tell you all about carrier screening and how it can be used on the journey to build and grow your family.
Carrier screening is an interesting topic in the sense that when patients are thinking about fertility treatments, trying to maximize their fertility, I don't think that carrier screening was a part of that conversation for a very long time. And I think now it's coming more to the forefront. Certainly, we're seeing a lot more of it in the US in terms of how many patients are doing it. And I'm sure that's going to move to Canada. So, this is a very timely topic. And hopefully, this will open some people's eyes to another opportunity for testing and for trying to have a healthy baby.
Absolutely.
Okay, so let's get into it. What is carrier screening?
Carrier screening is a genetic test. So it's genetic testing that really is screening the genes. And the goal of this testing is really to identify whether someone is a carrier of one or more genetic conditions. And this information can be helpful because it can provide information about whether there's an increased chance to have a child affected with one of the conditions that we're able to screen for. This can allow people to have information about whether there is a higher chance for their children to have a genetic condition. It may allow them to explore additional testing options to try to minimize that risk, or to learn more about the disease that their child may be affected with to perhaps be prepared for that reality at the time of birth.
Can we go back to a little bit of genetics 101 again here and talk about what does carrier mean? What is this concept? What does it mean to be a carrier of something and how that works with the chromosomes?
For sure. Okay. So, as a bit of an overview, our bodies are made up of millions of cells. And in every cell of our body, we have hundreds and thousands of genes. Each gene is telling our body to do something. So, a gene is a unit of DNA, which is that genetic molecule. It's giving our body important instructions. And our genes come in pairs because at the time that an embryo or a pregnancy is created, half of the genes are present in the sperm and half of the genes are present in the egg. So one copy of each gene that we have in our cells has come from the egg that has created us, and one copy has come from the sperm. We have two copies of each of our genes. A carrier is someone who has one copy of the gene with a genetic change. We call that a variant. We use the word variant to refer to a genetic change. And then one copy of that same gene that is working just as it should. And carriers are usually healthy because they have one copy of the gene that's able to function and provide the instructions for their bodies.
You said genetic change. So you're talking about something that could potentially cause disease, right? If a carrier is somebody who has one gene that has this genetic change, then what if somebody has two copies?
Exactly. So when a person is a carrier and they're thinking about having a child, it can be helpful to know if their partner or if they're using a donor, if the donor is a carrier for the same genetic condition, then we know that there could be an increased chance for having a child affected with that condition. And so carrier testing can be useful to know if one is a carrier for any genetic conditions. And in that case, we would advise people to perhaps have testing for their partner to know if their partner is also a carrier for the same genetic condition.
Can you give us some examples of these genetic conditions? What are we talking about here? What kind of diseases?
The diseases that we can screen for can really vary in how they might affect a child. With carrier screening, as you mentioned, as time has gone on, we have the ability to screen for more and more of these conditions. And currently at Markham Fertility, the test that we are working with for expanded carrier screening, we can screen for over 600 genetic conditions. There are many labs in the US that offer this type of testing, and the number of genes or the genes that you can test for with this panel can really vary from lab to lab. But in general, we now have the ability to test for more and more of these genetic conditions that could impact a child's health. The conditions really vary in how they affect a child's health. Some are things like inherited forms of hearing loss or vision problems. Some conditions are what we would refer to as neurological conditions that could affect the neurological system. Some conditions are going to affect not only the health, but also perhaps could lead to learning disabilities or developmental delays as well. So some conditions can be more severe and some can be less severe.
How common is it for somebody to be a carrier of something? Everybody is a carrier of something, and it's just a matter of figuring out what it is, or is this
Right.
like a super rare thing?
It's really common to be a carrier. In fact, we're all probably carriers for a few genetic conditions. So depending on what study you look at, some studies will say, maybe we're a carrier of between 2 and 5 conditions. Some studies might suggest that we're a carrier between 3 to 8 conditions. So it's very common to be a carrier for a genetic condition. Yes, this testing can determine what we are a carrier for, keeping in mind that we are only able to test for some genetic conditions. So while carrier screening can screen for over 500 conditions, we have about 20,000 different genes. So really, we're focusing in on some of the genes that we have an understanding about, that we have knowledge about, and the ability to screen for. And carrier screening is usually including genes that are related to health issues that would affect a child. With carrier screening, not typically screening for inherited conditions that present with symptoms later in life in adulthood. We're really focusing on those conditions that can affect a child's health or development.
Thank you so much. That's a great overview of carrier screening. So let's say there is two people who are healthy trying to have a family, somebody that makes eggs and somebody that makes sperm. So male at birth and female at birth, and they don't have any medical issues and there's no family history. Should they be doing carrier screening? Or I guess another way of asking that question is who should be doing carrier screening?
Mhm. Yes, absolutely. I mean, carrier screening is available, and as with any genetic testing, it's optional. But really, anyone who's thinking about having a family, about starting their family or having a child, could consider carrier screening. In fact, we know that we're all carriers for some genetic conditions, and most commonly, two members of a couple are often not carriers for the same genetic condition. However, the only way to know what we're a carrier for, and if we happen to be a carrier for the same condition as our partner, is really to do carrier testing. We know that most babies that are born with one of these genetic conditions that we can screen for are born to families that don't have a history of that particular condition in their family. Most babies with a genetic condition are born without the knowledge that there is this increased chance to have a child with that condition.
That's really interesting. Although we're a fertility clinic, we talk a lot about infertility and difficulties with conceiving. You're saying that carrier screening is something that anybody who's considering conceiving or who's planning their family outside of fertility or infertility that that's something that people should be aware of, at least consider.
Absolutely. Carrier screening, looking at hundreds of genes, is not something that's standard of care. It's an optional test. It is a private pay test. I think historically, when we think about carrier screening, we have focused in on testing for certain genetic conditions when there's a family history of that condition, or looking at one's genetic ancestry. Where did they come from in the world? However, as we learn more and more about our genes, we realize that that is limiting. Testing only for conditions that are more common in our ancestry, for example, we're missing many conditions that we might be a carrier for. And so, as our understanding of our genes has evolved, we now can offer this, we call it expanded carrier screening, looking at hundreds of genes, regardless of one's ancestry or where their ancestors came from in the world.
Can you talk about carrier screening in the context of donor and surrogacy as well,
Mhm.
and why it's so important in that patient group?
Yes, for sure. For people who are using either donor egg or donor sperm in order to create embryos, donors often have had carrier testing. So, certainly, people who have donated sperm and frozen eggs almost always will have had some carrier testing. Depending when they had their carrier testing, that will determine perhaps how many genes they've been tested for. I think people who are using donor egg and donor sperm are often considering carrier testing for themselves to know if they are a carrier for any of the conditions that the donor may also be a carrier for. When people are using donors who are undergoing an egg retrieval, so fresh eggs, sometimes donors of fresh eggs have not had genetic carrier screening. And so that's a big part of our program here at Markham Fertility, is to meet with donors, to offer them carrier screening, to review those results with themselves, of course, but also with the people that will be using their eggs to create their embryos.
Let's say somebody has undergone carrier screening with their partner and there's a match. So, what I mean is they're both carriers for the same condition. Where do you go from there?
That's a great question. Certainly, we want to provide them with as much information as possible about what that gene involves, what condition is related to that gene, what that would mean for a child if a child was to inherit the non working copy of the gene from each of them. And we would also offer options for minimizing the chance to have a child affected with that condition if that was their wish. We can offer what's called PGT-M testing as part of an IVF cycle to determine if the embryo has inherited working copies of those genes, whether the embryo is expected to be a carrier, so healthy, but has inherited one copy of the gene not working, or whether the embryo has inherited two non-working copies of the gene, which would mean that if we transfer that embryo, then that would be resulting in a child with the symptoms of that condition. We also can offer options of prenatal diagnosis or prenatal testing. So some people may still conceive on their own, but do testing once they're in a pregnancy to know if the non-working copies of the gene were passed on to the pregnancy.
Can you explain PGT-M in the context of PGT-A?
PGT-M stands for Pre-implantation genetic testing for monogenic disorders. So that's a bit of a mouthful. PGT testing is when we are able to biopsy and complete genetic testing. So sample embryos that have been created with IVF. By sampling and taking a few cells from each embryo, we can send those cells away to a PGT lab, so a lab that's specializing in testing embryos to determine if the genetic condition is expected to affect that particular embryo or child resulting from that embryo. PGT-M is very specific to a family that is known to have an increased chance to have a child with a single gene or a monogenic disorder. It does require that the family or couple has a workup to make a test that can test their embryos. PGT-M is very specific to the genetic changes that have been found in the person providing the egg and the sperm. So it's very specific for those gene changes and the condition related to that gene. It's more involved than PGT-A testing, which is that more routine test that's able to look at the chromosomes within the cells of the embryo. PGT-M can really give information to couples and patients who know that there is a higher chance for their embryos or children to have a specific genetic condition. We can use that technology to selectively transfer embryos that are expected to have a low risk to be affected.
If someone does carrier screening and they identify a single gene disorder or monogenic disorder and then decide to pursue PGT-M, does that mean they do not have to do PGT-A?
That's a great question. PGT-A and PGT-M are different. We can complete both tests on the same sampling of cells from the embryo, so that same biopsy sample, but the tests are different. PGT-M is going to give us answers about the very specific gene changes found in both of the parents or the egg and sperm provider. PGT-A is that more general test looking at the chromosome DNA, and PGT-A would still be important to provide information about whether there's any chromosomal differences in that embryo. So it's the PGT-A results that can really indicate if that embryo has a higher chance for implantation in pregnancy, whereas PGT-M is going to give us information about whether that embryo is expected to result in a baby that is affected with a genetic condition or is not affected with that genetic condition.
And they usually do it sequentially. So, for example, if you have 5 embryos, they would test the PGT-A first. And if there's embryos that are chromosomally abnormal, there is no point in finding out if they have the gene disorder or not because they're not viable for pregnancy. So then they're only doing the PGT-M in embryos that are chromosomally normal. That's another important distinction between the two.
Exactly. Those options certainly exist. Absolutely. Some people will do the testing sequentially, PGT-A first. Some people choose to do PGT-M first. Some people will want information about PGT-A and PGT-M on their embryos. And I think sometimes it's just dependent on the specific conditions that we are testing with PGT-M. But yes, all of these options do exist, and all of these options would be discussed for anyone who's considering PGT-M testing.
Let's say somebody is listening to this podcast and they're interested in hearing more about carrier screening, or somebody's already a patient at Markham Fertility Centre and they're interested in carrier screening. What are the logistics? How do you go about organizing this? How do you do this?
If you're a patient here at Markham Fertility Centre, the next step would be to request an appointment with myself or one of the other genetic counselors here at the clinic. We're happy to answer any questions that you might have and arrange the testing. We also do have a carrier screening live webinar, so you're welcome to join our live webinar as well. But we want you to have an opportunity to learn more about this option, to ask questions if you do have any. If you decide to move forward with carrier screening, then we would organize a blood draw here at Markham Fertility Centre and send the sample to the US lab for testing. Results are usually coming back in about 3 weeks. And another option, if you're not close to the clinic, would be to provide a cheek swab or a saliva sample. And we could arrange that for you as well so that you could ship that sample directly to the lab if that's more convenient. And if you're not a patient of MFC and you want to learn more about carrier screening, I would recommend that you ask your family doctor for more information.
And how much does a standard carrier screening test cost?
Currently, here at Markham Fertility, with the lab that we're working with, the cost is $520 per person.
Okay, so if we're testing both partners, it's double that.
Mhm.
Let's add this is July 2024 for anybody who's listening to this, years later. It might be different by then.
And so let's say there are 2 partners and a couple. Do you test both of them at the same time? How do you do that?
Some people do wish to start with one member of the couple first. In that case, I would recommend starting with the female partner because as females or those who are assigned female at birth, we have 2 X chromosomes, whereas males have an X and a Y chromosome. So as females, we could be carriers for conditions that involve genes on the X chromosome. And as such, when we are having genetic testing completed on females, there's more genes that we would add to that carrier screening panel to screen for those conditions that we refer to as X-linked or related to genes on the X chromosome. And so if it's a female and male couple, I would say testing on the female partner first because we're screening for more genetic conditions. I think to that point, it's also important to know that when we're doing such extensive carrier screening, most people are found to be a carrier for one or more genetic conditions. It's very common that one would be found to be a carrier. And so in that case, oftentimes then the other partner is having genetic testing. So it's just important to know that if that's the plan, that most likely most people go on to test both partners.
In the US and fertility clinics, we're hearing that doing carrier screening or patients who are presenting to a fertility clinic, it is standard of care that they should be offered carrier screening as part of preparation for fertility and fertility treatment. So my question for you is, where do you see this going, let's say in the next 10, 20 years in terms of genetics and carrier screening?
I think we will see more people doing carrier screening in the next 10 or 20 years. You're right. I think more people are doing carrier screening in the US and perhaps other countries around the world than what's being done routinely here in Canada. As our knowledge about our genes and the availability of carrier screening continues to improve and evolve, more people are likely to opt for carrier screening as they think about starting their family.
Thank you so much, Diane, for that detailed information about carrier screening. I love listening to you. I always learn something new every time we talk about all things genetics. We'd really appreciate you and can't wait to have you back for another episode on the options about prenatal testing. So stay tuned for that, everyone.
Thank you for having me.
And that's a wrap for today, Superhumans.
If you're looking to connect, get social with us. Follow us on YouTube and Instagram at My Fertility Podcast or visit us online at markhamfertility.com. And don't forget, follow, subscribe, and share your favorite episode.
Thanks for listening to My Fertility Podcast and for being a vital part of our community. We know you've got this.
We're signing off until next Tuesday.
If you found this episode of My Fertility Podcast helpful, please take a moment to head over to the review section and leave us your thoughts. Your reviews and comments are incredibly valuable to us and help guide future episodes. We also welcome you to direct your questions to info@myfertilitypodcast.com.
My Fertility Podcast is produced by Rabbit Media Inc. in conjunction with Dr. Garcia and Dr. Weiss. Music from Mix Kit Raising Me Higher by Ajay Stelino. My Fertility Podcast is not intended to replace any type or variation thereof professional medical, health, or legal advice, nor should the content be taken as medical advice. Please contact your primary healthcare professional regarding any medical questions you may have. The information presented in this podcast is based on the knowledge and understanding of the host at the time of recording. Medical knowledge is constantly evolving, and new research may change the understanding of health-related topics. While we strive to provide accurate and up-to-date information, we do not guarantee the completeness, accuracy, or timeliness of the content. The views expressed in this podcast by guests are not those of the host or the management. This podcast is not intended to impose any type of discrimination. My Fertility Podcast and its management are not responsible for any losses, damages, or liabilities that may arise from the use of this podcast.